very much. I think perhaps I should start with declaring my conflict of interest. Some 11 years ago, I met this gentleman, Sweet, at Bellagio, and he keeps impressing me with this analytical thinking and the role of the champion. And today was no exception. Continue impressing me, please. Some 12 years ago, there was a report, the Foresight report in infectious diseases preparing for the future. I was lucky to have been involved as one of the scientists who were involved in that study. It studied the whole world, it studied the global issues, but it had three strands. The global picture and the focus on the OECD countries, a strand for China representing the emerging economies, and a strand for Africa. And that then got me to start thinking that context specific is the way to go. And in one area, I think, as we say, there is no different, it should not be different, it shouldn't be one measure fits all. And then, some 10 years ago, I was lucky, by the way, the 11 years, one of the things which came out of this encounter with this gentleman was to set in motion a thinking that has ended up into a new organization called CODES. I encourage everybody to go to the session on Monday at 10:30, which will be about we'll discuss about CODES. When we set up SASI 10 years ago, there was the issue of who is going to be our audience. We just come out of this Foresight study on infectious diseases and everything that you know about movement between species. It was going to be our audience, it was going to be our champion, it was going to be our partner. So now when you ask me who is the right audience, I find it very, very difficult because the right audience also relates to what's message. So I'll be talking about context. I'll also be talking about the information, informing or engaging research. So when you see this, published just 3 years ago, the Royal Society, the way we will address here in Canada, and we just said a few minutes ago, infectious disease, should that be the same way we address it in Africa? And within One Health, we've found this problem is in a way whereby for us in Africa, we would like, some of us, we would like to see One Health as the mainstream for approach for dealing with infectious disease. But when you come into a world which is dominated by consideration of the OECD, if I'm here in Canada, what would concerns me is what comes from over there, the problem from yonder. And so I'll be concerned with emerging diseases. I'll be concerned with the zoonotic diseases. But should that be the only thing I should be concerned with in tropical Africa? And so that comes to the message and the context. I contend that for us, infectious disease is not just marginal, because when you only consider a category of oneness will come in only when that is in question. For us, it should be mainstream, the way we should be dealing with infectious disease. That is one context. This evidence, 11,000 deaths in West Africa. How do you project that? In the science, of course, this is dangerous disease and of international concern, of course. But perhaps there is another message that we should be presenting to our populations in Africa and our policy guys. That this was started with one boy, the end of December, the end of 2013, showing disease, vomiting, and so on, and died. 3 months later, it took 3 months before this was identified as Ebola, by which case it had spread to capital city in Guinea, and it started spreading in other countries. And then when the international community gathered momentum, was called in, it was about 8-9 months, and that is what it resulted in 11,000. The health systems were overwhelmed. But then, should we not be saying to the policy people that if only we had been able to identify that boy and identify the disease when that boy went down, how many lives would we have saved? And so maybe make a demand, make community and policy, make a demand to science rather than community and policy depending only on us to tell them science. Because in this case, an informed community would give us, we can't have this. Why did it take you so long? And there should be science to be able to do that. I'd like to, tomorrow afternoon, there'll be some discussion about these kind of issues. And so again, getting to this underserved community in the international sense, you find these are the problems we face, and where you're working in remote areas that's where disease starts, your lack of diagnostic facility at that area, limited diagnostic capability within the country, and poorly or inadequately funded diagnostic labs. So all in all, you also get this thing whether, in this country is poor or inadequate surveillance for viral diseases. So when we're doing discovery research at the international level, and the problem is out there, so how do we translate this? Because the language you're using at the discovery level of research is foreign, not only to the communities out there, but sometimes and not infrequently to the policy guys and perhaps even scientists on the ground. Yet you have high quality science, but the impact may be low in the context. We face another one. Where are we? Again, I'm going back to 2007-8 when we started. You have academic institutions and national institutions in these areas, and each competing to influence policy. They don't talk to each other. And the policy guys don't talk to them. They mistrust them. So the little science that is being generated is having mixed impact. And so when we're thinking about our audience, so what then organizations like SARS knew what's the niche. So we started what should be our strategy. And I can summarize it into 3, and we try and calculate that into our students as well. That will work as a virtual center. And that is in the context of the underprivileged and under-resourced systems. You recognize that take any one institution in isolation does not have what it takes to answer the magnitude of them. But the poor resource, into form a kind of virtual center, you enhance the ability to do some worthwhile program. That smart partnership with those who are at the discovery end is likely to enhance the quality of research, and that it operates in a community of practice. Even those students will be operating in a community of practice. And so that is how we came to define sciences. On one hand, that you interact with the discovery, on the other hand, that you're now bringing the academic and research institution together, and then together with them, you're trying to influence policy. That's our objective, and I'll show you some results. So, start with vision. What is our vision, Science? I want to go through a conversation with this young lady, Sarah, a community animal health worker in the north of Tanzania. And then she said, what? So if I turn around and say, yes, our aim is to do research, to try and protect your community, protect your lives, protect your wildlife and your environment from epidemics. Now you are talking, because now we are relating to our own interests and the interests of that community. Here, again in Maasai land, you go start talking with the elder, as you see. This young man comes in. What's the mission of these people? What do they want here? And you go into this jargon in order to announce and so on and so forth. So a young lady, Sarah, said, but then if you say, yeah, we're trying to develop tools that could pick up, this thing what happened in West Africa, if you only could pick it up there and identify it, we'll be able to protect your community. Then it's message related to that they own, the community can subscribe to. And therefore you can do this kind of research, and then you're trying to bring whole genomes, next genome sequencer down to even to nanopore now. What I'm showing you on the left here will be, this is mobiles in detecting disease events. There will be a session about that tomorrow. And where technology is going, and this link up I talked about with smart partnership, I think together we should be, really should be on a race towards not only detecting, but identifying pathogens as close to source as possible to avoid another 11,000 dying unnecessarily. And so out of context messages, including antimicrobial resistance, could be problematic. I've got a young guy called Peter Mangesho, a social anthropologist. He works in the Maasai. He says these communities, when the livestock need health attention, they revert to Western medicine. When they themselves or their families are sick, the first point of call is traditional healers. Now, about 2010, there was concern both in Tanzania and in Kenya about substandard drugs, usually imported, and giving a bad reputation. This went around. So that kind of message came round. If only you could go and take a cup of the traditional medicine, that would be this. Forget about all these fake medicines. And it wasn't such a joke, because so these This is the gentleman. And this is the kind of crowd which was coming to this area. It took about 4 months, and it took Prime Minister of the country, this gentleman here, to negotiate with traditional healer. But then, of course, it has also had some benefits. There were more telephones put in that area, and we are taking advantage of that with mobile technology for the disease surveillance. And the people in the universities are now doing, not regarding traditional medicine pure as witchcraft. They're doing some research on that. But antimicrobial resistance, if we push wrong message, that could have all the same about antimicrobials. That could have the same effects. Let me give some examples of engagement as opposed to informing. In this case, we prepare policy briefs, we have seminars. This essentially is about informing fellow scientists and officials who speak our language. Take this example from Suwit in Thailand. This is a wonderful, wonderful annual event of Prince Mahido conferences. It's so different from other universities. That's not just simply a conglomeration of scientists talking scientists. As it comes to, where am I going? Seems to me, and thank you for introducing me to Prince Mahido over the years, what I get is it addresses communities. And the first day you do, in fact, you do a field trip. It engages the youth, and it engages the global scientific community at a very high level. This is soon becoming a mass attend, like the last one we had in January. And then it involves international and national authorities. The last one, in fact, got to the point of involving the DG of WHO and the Chief Medical Officer of the UK in a debate which they lost about managing pathogens. In countries like Tanzania and in Kenya also, we're now getting, we're learning from Canada, by the way. We're trying to bring One Earth into government. In Tanzania, there's now a One Earth platform within, a national platform within the Prime Minister's office, which takes it at the center of government. And in parallel with that, we and OSEA, we've formed, we convene networks, and together we interact with the government, both in writing their policy like this one on antimicrobial resistance, which we now also own, warts and all, which was more than in the past where they only tell us. Involving champions, and in this case we have Vice President of the Tanzania launching our business plan, but then becomes our champion. Here we are in the university, we're engaged in trying to bring in new things. We have workshops with the vice chancellors on transformative leadership. They become our champions. Yeah. Now, let me just do quick this one, whereby this is rather unique. We start, we call it EPIAC. It's a group of this is medical virologists, veterinary epidemiologists, IT programmer, and this is a medical officer. On one day, we discuss what are the issues. The next day, we go in the communities, what are the issues. The third day, we come back and try and put in a One Earth framework. And the next 3 days, these programmers work around the clock. At the end of that, they gave us four prototypes of what we should put into a program. Tomorrow, you'll hear more about what it does there. That's engaging the communities, engaging policy in planning. And when it's so done, a few months ago, we launched that program. Again, we use the community and the community radio and the higher level. So we can now come to a point whereby I'd like to leave you the message whereby we can aim towards community One Health security as the cornerstone for national and global health security. When we're coming here, they said, what are take-home messages? Please allow me to make reference. Most of the time, we in developing countries, we try and do a little bit of research, but these two are areas which we ignore, which is networking, think tanking, in context, what it means for us, and then translation research into policy. So take-home messages coming to these 6 points. That is smart partnership enable us to accelerate the generating the science evidence. That engagement of communities and policy, both in terms of planning and then later on keeping them informed, gives us a better strategy than otherwise. That context-specific think tanking and evidence-based policy advice is essential, and that there needs to be some investment into translational and implementation research in situ, so that the translation of research findings into policy is context-specific. And we are weak in communicating science. There are very few science writers in developing countries. And finally, bring in the concept of impact in project design, whether funded from outside, from within. And finally, I want to thank the people who support us. And I was glad the first year speaker was from the World Bank, because now we are World Bank funded and designated Center of Excellence, African Center of Excellence for Infectious Diseases. Thank you.